Yes. So good evening, everyone. And it's my privilege to introduce the resource person of today, Dr. Annapurna CM. Dr. Annapurna Anuparana. So it is Anuparana.
Good evening, doctors. Dr. Triveni, we can start the meeting, I think.
Yeah, ma'am. Yeah, I'll do it. Very good evening to all the respected dignitaries, our distinguished speaker, and dear colleagues. It gives me immense pleasure to welcome you all for this much awaited Women and Child Health webinar series hosted by IHMA National Women's Wing. Today, we gather as physicians, researchers, and healers, but with the prime purpose of advancing our knowledge to improve our patient care. And we at IHMA are proud to be a part of your journey. I, Dr. Triveni Bangera, on behalf of the organizing committee, extend a warm welcome to each one of you. This free webinar series on women and child health includes sessions on autism, learning disability, women's health and developmental disorder. These sessions are taken by our esteemed delegates such as Dr. Rekha Srinivasan, Dr. Anupa Rani CR, and Dr. Shalini JP. Before starting today's session, let us take a moment to remember our Reverend Master, Dr. Sam, to whom we are forever grateful. This October month is dedicated for learning disability and includes discussion on what is learning disability and its causes, pathology of learning disability, its implications, symptoms and manifestations, diagnosis and treatment, and homeopathic intervention. And these sessions shall be taken by our very experienced speaker, Dr. Anupa Rani CR. I request the delegates, if any doubts or questions, kindly message in the chat box and it shall be addressed by ma'am towards the end of the session. Thank you. Now, without wasting any further time, let us dive us into the session. To introduce our speaker, I invite Dr. Deepa Rebello, Deputy Medical Superintendent and Associate Professor, Department of Pathology and Microbiology, Father Muller Homeopathic Medical College, Mangalore, to do the honors. Over to you, ma'am.
Yeah, thank you, Dr. Triveni, and a warm good evening to one and all present over here. So it is my privilege to introduce the resource person of the day, Dr. Anupa Rani. So Dr. Anupa Rani, she completed her graduation from GHMC Calicut. She also did her post-graduation diploma in management of learning disabilities from the University of Calicut. Ma'am started practicing homeopathy since 1992 and developed keen interest in treating children with learning behavioral disorders and emotional problems, and also started treating such cases in the year 2000. She is a consultant of childhood disorders at Experts Homeopathic Hospital. She conducts training program for parents, professionals, and teachers as well. She also conducts a lot of group trainings for medical officers of ISM department and of NHM, and also the paramedical staff such as nurses, speech therapists, occupational therapists, pharmacists, psychologists, and special educators. She also conducts group training for IMA, Vanita Wing, and also IHMA Thrissur on a regular basis. She has conducted training for Project Sadgamaya of Department of Homeopathy, Government of Karnataka. She has published various articles on learning disabilities, autism, behavioral, emotional disorders in various journals and magazines. She has presented papers on various international and national seminars on learning disorders, autism, and behavioral disorders. She conducts skill development camps for children and adolescents. She herself has participated in various national and international trainings in disorders of children. Overall, she has conducted more than 1,000 awareness programs for parents, teachers, physicians, medical workers, Anganwadi workers, special educators. And we are very happy to have her amongst us here today for this program. And I welcome you, ma'am, and I request you to kindly take over the session.
Thank you. Thank you, IHMA Women's Wing, for inviting me to do this 4 sessions on learning disability. So, Dr. Jagadi will be sharing the screen. Thank you, Dr. Jagadi. First slide, please. Today, we can go directly to the topic, what is learning disability? That's the first thing we have to know. And what are not learning disability? Okay, both we have to understand. So first slide, please, Jagadi, doctor. Specific learning disability is a disorder in one or more of the basic psychological processes involved in understanding or using language, spoken or written, that may manifest itself imperfect ability to listen, speak, read, write, spell, or to do mathematics, think calculations, including conditions such as perceptual disability, brain injury, minimal brain dysfunction, and dyslexia. And SLD does not include learning problems that are primarily as a result of visual, hearing, motor disabilities, mental retardation, emotional disturbances, or environmental disadvantages. So, what is a specific learning disability? It is a disorder where there is disorder in the basic psychological process involved in understanding or using language. That's the main problem here. The language, they have difficulty in using language in any, even in written form.
Excuse me,
or
ma'am.
in-
One
Yeah.
second.
Yeah.
Is it visible? Like the slide?
Only the first slide is, show the second slide. I am reading out from
One
that.
second. Okay.
Mm. Okay, can you see the slide? That is the,
Okay.
yeah, okay. This I was
Yeah.
reading out.
Okay.
It is a disorder in the psychological processes of understanding and using language. The way you speak, the way the child writes, both are affected. And even in the child has an imperfect ability to listen also, not just use language or in reading or writing or written, but also to understand what he listens or to speak and to spell. And also in the mathematics, he has difficulty in doing mathematics think calculations. And also it includes also perceptual disabilities, minimal brain injuries, minimal brain dysfunction, and dyslexia. And it does not include, that's what we have to understand, does not include any learning problem due to visual problems or hearing problems or any disabilities like spasticity or anything, motor disabilities, mental retardation. Retardation does not include learning disability. It's not learning disability. When there is a mental retardation, it is not. Learning disability children have average IQ. That is in between 85 and 120. The average IQ will be between 85 to 120 IQ. So if the child, this learning disabled child will fall in this category. If it is below 85, that 85 to 75, it is called slow learning. Okay, and below that is mild mental retardation, and below that is mental retardation. So these categories won't. It's not called as learning disability. Only the children who are in the average category of intelligence are considered to have learning disability. Other conditions are named differently, like slow learning, mild mental retardation, etc. And if there's any emotional disturbance, lot of learning problem occur due to emotional disturbance. The other day, a child was brought to our clinic. Her father died. Died means he had hanged. She saw the father hanging. After that, she doesn't want to go to school. She doesn't want to study. And that's not learning disability. That is emotional disturbances. And also, if there is a learning problem due to environmental disadvantages like having a war, if there's a war, the children won't be able to go to school. Even during our COVID conditions also, many children couldn't go to school. And many of them had problems with understanding what is being taught, online classes. They all had, many of them had lots of problems. And all that does not, that cannot be considered learning disability. Specific learning disability means it should be an average IQ, and it's only the processes of learning are disturbed. Okay. These conditions like visual, hearing, or motor disability or mental retardation does not include any learning disability. All those are different conditions. So you can go forward. The next slide. That is, what is learning? There are two words in this. Okay, learning and disability. First, we can see what is learning. Learning can be defined as any relatively permanent change in behavior as a result of practice or experience. When we have an experience, any experience like we practice, like we start studying cycling, or we learn driving, or we learn swimming, or we learn music to sing. There is a change in our behavior. That means that is, we starts to sing or we can drive. All this we can see in our behavior, changes in our behavior, and that is permanent also. Once we learn to swim, we never forget it, isn't it? Once we learn to drive also, it comes automatically to us. comes automatically to us.
എത്ര വെച്ചാ കൊടുക്ക്?
Somebody is that's on the mic. Please off the mic. Somebody, I don't know who it is. Off the mic. Okay. So the change what happens after learning happens is a permanent change, and that we can see in the behavior. Once a child learns to sing, any Carnatic music or whatever, the child starts singing on the stage, or he starts performing, or he starts performing. So there's a change in his behavior. So this change in behavior happens when the learning, when the child has learned. Okay, next slide, please, Jagadi. What is learning? Okay, this is a process that leads to change, which is a result of experience. That's what we have been explaining now. It's a process that leads to a change. Next slide, please, Jagadi.
Excuse me, ma'am.
Next slide. Next slide.
Ma'am, sorry to interrupt, ma'am. There was a little issue regarding the volume, ma'am. If the volume could be a little louder, many delegates
Oh,
have
okay.
mentioned.
Yeah.
Yeah.
Can you
Thank
hear me
ma'am.
now? Can you hear me now?
Yeah, ma'am. Yeah.
Yeah.
Okay,
Okay.
ma'am. Yeah. Thank you,
Okay.
ma'am.
So, next slide, please, Jagadi. The process that leads to change, which is a result of experience. We have experience and we change our behavior. And one more thing happens when we learn new skills, or when we have new experiences, the learning happens. And what happens is they increases the potential for improved performance and future learning. See, once we have what was our behavior before we completed our medical degree? Hasn't it changed a lot? Once we gained our medical degree, basic degree, we have changed a lot. Then there's a chance for future learning. That is, we can go for MD, we can go for a PhD. Okay, and our performance is improved as physicians, as persons, as individuals also. So learning changes leads to change. Okay, and these children who have learning disability, these changes won't happen. And there is impaired learning, these changes won't happen. They cannot grow up to their full potential. They cannot improve their performance, either in reading, writing, or doing mathematics, or any other performances. Many of the performance they will have difficulty, and also future learning is also not possible for them. Okay, so learning is essential for our existence. Actually, it is essential for food nourishes our body, isn't it? What food we take, it nourishes our body. But information and continued learning nourishes our mind. It nourishes our mind, and we need to learn for our existence. If we don't learn to run away when there is a threat to us, like if we see a tiger, and if we don't understand it is a tiger, isn't it threat to our existence? Isn't it? So if learning is essential for our existence, as food nourishes our body, the information and continued learning nourishes our mind. If the child is intelligent, very intelligent child, they have to learn. They cannot help to learn, to be without learning. So they'll find out ways to learn. We know of many people who didn't have any childhood education also. When they grow up, they found out their ways of learning new skills and how they achieved in life. So when you have an intelligence, we have to learn. We learn. Have you seen small children, very small children? They started walking. Once they start walking, they'll find out what is there on the table. They'll climb on the table. They climb on the window, and they have to see what is there. They have to learn what is there. They have to learn new skills. So they'll try a lot. Even if we don't give to many children, if there is less stimulation, also they'll learn. Okay, because when they are intelligent, the learning can't be stopped. They learn many things from the external environment. The stimuli they get from the external environment helps them to learn. Okay. Dr. Jagadi, this the slide number 5, which I was explaining. Can you go to the slide number 6? Slide number 6, Dr. Jagadi. Learning is an adaptive function, and we can adapt when learning happens, we can adapt to the change. And when the environment needs adaptation, when we go to a different country, when we get a job in a different country, either like in Kerala, in Gulf countries, or in United States or UK, anyway, Australia or any place. When we go to a different country, what will happen? We adapt to that situation. We learn how the people behave, how what they're doing in social surroundings, and we learn and we adapt to those changes. So this is an adaptive function. Learning is an adaptive function. And nervous system changes in response to stimuli in the environment. When there is stimuli from the environment, our nervous system changes. That is how it changes. New synapses are formed. Neural connections are formed, and we see that the stimuli, when there is a permanent change in our system, our behavior also changes. Okay, the changing of behavior response are permitting us to function in an environment. We take cues from the environment, and the nervous system also adapts to it. Like once the child is born, newborn child does not know to speak, does not speak. And there is a stimulation of language from the surroundings. People talk to the child, people learn, the child hears the language, hears the words, and slowly the change in behavior occurs. There is connections, neuronal connections are built in the language area, and the child learn to speak. And if the child is hearing impaired, it cannot speak because it does not have the stimulation from the environment for the language. So new connections are made in this language area, and the child starts to speak. Okay, so that such types of changes in the nervous system happens in response to stimuli from the environment. And this change and child starts to speak. Until then, child used to only cry. If the child has any need, it cries, and the people around the child has to help the child. Once the child learns to speak, if it is hungry, or if it is thirsty, it can ask for food, it can ask for water. So change in behavior and responses happen when there is learning, when learning happens in response to stimuli from the environment. Okay, next slide. Learning involves physical changes in the nervous system. That's what I was talking now. Learning involves physical change in the nervous system, like strengthening of the synapse, activation of the neural pathways, and pruning of the neutral pathways, and or it is rerouted. Some pathways may be there's some injury, like in any damage to the brain while during birth, or in some damages in the brain due to injury or something. That neural pathways may not function properly. It will get rerouted if the learning, if there is proper learning, it get rerouted, and that is where we can help the child with learning disability, minimal brain damage, and all. This neuronal connections get rerouted, and which neurons are not being used, which like some reflexes. At birth there are some reflexes, later on we don't need those reflexes, that is pruned. That neurons are not in use from once that reflexes are not needed for the child, that neural pathways are pruned, it won't work again. Okay, and the result is, anyway, whatever happens in the brain, the result is behavioral response. The outcome is behavioral response. So learning and behavior are connected very closely. So if you see a child with behavior problems, you have to look into whether the child has any problem in learning. When learning happens, like there is strengthening of neural pathways, activation of new neural pathways, and the child learns and child knows how to change, how to adapt to the new environment. Once the child goes to school, when there is when these neuronal connections are correct, and there's no problem in his neuronal connections, and if he has the processes in the brain actually happening properly, within a week time, the child adapts to the school surroundings. If the child is go on crying, and if the child is not adapting to the school situation or in any new environment, you have to look into the pathways, or if there is any problem in learning, any disturbances or disability in learning. Okay. So the next slide. Learning instincts and reflexes are innate. Instincts, we have lots of instincts, and reflexes also, hunger, thirst, and all. Those are innate that we need to learn. That's needed for our survival. We are born with those reflexes and instincts. Okay, hunger, thirst, sleep. When the response to pain, crying as a response to pain and all. Those instincts and reflexes are innate. Here, learning is not needed. This occur naturally. In learning, there are change in behavior which result from experience. For learning to happen, there should be an experience for the child or for anybody, for us also, or anybody. There should be an experience. From that experience only, the change in behavior happens. If there is a learning happening, there's a change in behavior. And for that, you need experience. Even if there is experience, even after the experience or stimulations, if the child is not able to learn properly, we should understand, we should know that the child has a problem in learning. And if the behavior is also not up to the requirement of the surrounding of the environment, also we have to look into if there is any problem in learning. Okay, next slide. This is what we have been talking till now. So learning can be defined as any relatively permanent change in behavior as a result of practice or experience. Why we are explaining this much is because we have to understand learning, only then we can understand what is the disability. Next slide. So when this is what I was explaining, there are learning has three main components: the stimuli from the environment, and once the stimuli reaches the brain, there is an integration, there is an interpretation, and after that only behavior happens. Why there should be an integration? Why there should be an integration? Because, next slide please, Jagadi. Why there's need for an integration? Because we see, we smell, we hear, we touch. Okay, all this stimuli reaches in different parts of the brain. You can see the brain, picture of the brain. See, vision is in the auxiliary, behind the brain, and the hearing is in the temporal lobe, touch is in the parietal lobe, smell is in the frontal cortex. See, all this reaches in different areas. Once all these reaches in different areas, how we understand what we hear and see together. You see, you can see me on the screen, you can hear me also. Now the brain processing both the things together. So all the stimuli reaching the brain will again travel to the articulate fasciculus, where all these stimuli are being integrated so that we can understand what is happening in the environment. It is happening in lightning speed, so that we don't know, we see, we hear, and we understand. It happens very fast. This integration happens very fast, and we understand what we are seeing, what we are hearing. Okay, when you see a word, when you see it is written mango, we can read, we can remember the sound, we can see the word, and we can also imagine a mango. All this happening inside the brain, but it is happening in different areas. It gets integrated in the temporal lobe. There is an arcade fasciculus. There it gets integrated, and once this integration happens, it is interpreted. Okay. Next slide. Next slide. There's integration, then there is an organization, how all these stimuli are get organized in the brain, and then only we interpret what we are seeing, what we are hearing, and as a result, and the outcome, what is the outcome? The outcome is behavior. See the next slide please. Next slide. See the experience. When the experience happens, we understand, we integrate, we organize, and we take a decision. From the decision, we take a position, and from the position, we behave. Like I told you before, if we see a tiger in front of you, see a tiger, that stimuli reaches the brain, and we know it is life-threatening. We take a decision, we take a position, and behave. We fly, we run away, or you fight. Or you can fight against it also. Both can happen. We can decide what to do. Once we see a threat to our life, either we can run away or if I can fight against it. Okay, once you see a thief in front of you, what will happen? Will you fight him or will you you go away to a safe place. So that decision we can take, and we can take a position, and we can behave. So this should happen. All the stimuli in the brain should integrate, and then only we can understand what to do. Even in reading, writing, also all this happens. Okay, when the child starts to read, to write, the child experience reading, writing, then it starts learning, then it starts reading on its own, then it starts understanding. Okay, all this happen, and his behavior changes. The next slide. The sensory integration and organization happens when there is a sensory input, sensory integration, sensory organization happens. Then there is an interpretation, there's decision, there's cognition and execution of the behavior. What helps the brain? See, there are a lot of areas in the brain. All these lobes are there. And how the brain functions. It cannot function as each part, okay? One part working here, one part working in another region. It's not like that. It should be working together. Well, there are networks in the brain available for us to work, and we can look into which are the main networks that helps us in learning. Okay, there are 5 networks. Next slide, please. There are 5 networks in the brain which helps us. There are lots of networks, but these networks help us in learning. Okay, right hemispheric dominant spatial attention network, memory emotion network, executive function network, face and object identification network, left hemispheric dominant language network. Next slide, please. Next slide. This we can look into which areas are there for each of these networks. Okay, this first, the right hemispheric dominant spatial attention network. If in this network, if there is any problem, the child will have problem in attention. It can lead to ADD and ADHD. Okay, which are the areas connected? See, cingulate gyrus, dorsal posterior cortex, and frontal eye field. All these areas work together for us to have our attention. Next slide. You can see the picture of the brain. See the picture of the brain. See the red color is the cingulate gyrus in the first brain picture. The red color is the cingulate gyrus, and the second picture is the vision eye field and the frontal eye field. Then there is the spatial. You can see in the brain below. There you can see the frontal eye field. All these areas should work together for attention to happen. Okay, spatial attention, what we are seeing, we have to attend to what all. If there is lots of distraction around us in classroom, there's a teacher there, there are other students in the class, then this child can look outside through the window, he can see the other children playing in the ground, or the child can look into the other classes seeing through the window. If there is any problem, if there is any disability, or if there is connectivity, no proper connectivity in these areas, the child will have difficulty in attention. Okay, that is ADHD, or it can result in ADHD or ADD. These see what all areas in the brain has to work together for us to have an attention. If you all are listening to me, if you can see me in the screen, and if you can hear and listen to what I am saying, your attention network must be working very, very properly. Otherwise, you will get distracted in the, you look outside or look to the, if you will be, most of you will be at home. You'll see the children in the home, you'll see the other people at home. Some will be watching TV, or some will be playing in the phone, or gaming or something. We'll see all those. And then we cannot give our attention to this session, or to what I am speaking. If your attention, if you have any problem in your attention, if there is any problem in this network, okay, we will not be able to listen, hear, or give focus to attention. Okay, so I can go to the next slide, Jagadi. So the next one is the memory emotion network. See what all areas are there involved in memory. Memory and emotion are closely knit together. Okay, there's olfactory complex near amygdaloid complex, and hippocampus area associated. Hippocampus area. You can see the next slide, please. You can see the picture in the brain where all these areas are there. See this that green color in the middle. That is the hippocampus, and the red color in front of that small area in front of that green small area, that is amygdala, and the rhinal cortex is just below these two areas. That is, smell is very much related to our emotions, and memory also is related to smell and our emotion. All this is limbic system, and limbic system is related to our emotions. So when some teachers teaches with a lot of emotions, stories, and all that, the child won't forget. This what we learned at school. If we like the teacher, we don't forget that subject. We like that subject. The teacher, we like the teacher very much. When there is an emotion involved, we don't forget much. Okay, when I can give you an example. Nowadays, it's not an example, but in nowadays, when we were in college and when we are getting ready to get married, the groom will come and see the bride just one time. Then they'll next they'll see only at their marriage function. But these people won't forget. Just once they have seen, and they don't forget each other. Why? Because such an emotion is involved in that relationship. We never forget who it is. But nowadays it's not needed, because everyone will be seeing the groom or the bride. They'll be frequently meeting once the engagement is over. And, when we used to, and even my parents, it was even difficult. Just they will see only just once, and they'll never, they don't have a chance to speak or anything. Only then they will see only on the marriage day. But they'll never forget the face. We'll even remember what dress we had worn on the day of first, that day when we first met a groom. Okay, or when you first met a bride. Don't forget all that, because it is so closely related to our emotion. We don't forget such things. So when you teach children, when there is a emotion involved, especially if it's love, if it is affection, the children won't forget. Children will learn better. And whatever we teach children, teach with emotion. When we also, when we learn, I think the teachers who used to teach us, whom you used to like, we never forget what they taught. Okay, so emotion is very important while learning. Even smell is also very important. One child whom I met, she had a learning problem. She told me she used to sit in the garden. She was very intelligent. She is a doctor. She finished the gynecology MD. Then she is doing nanomedicine now. She's working in the nanomedicine area. And she had a learning problem. She had spelling mistakes and all things. And she told me she used to sit in the garden and learn. So smell used to, I don't know, we have not worked in this area much. Smell used to stimulate memory. Even when certain smells, you can remember, when you have a certain smell around, we remember a lot of things. So it takes us back to a lot of memories. Have you experienced that? Never. Let's try out how smell influence our learning or our memory. Actually, next slide, please. This area, all of you know, that is left hemisphere dominant language network. That is Broca's area and Wernicke's area. Dr. Eka she's telling it to CSC, we remember, when there is emotion. See, Broca's area and Wernicke's area, we have learned a lot about it. One is the motor speech, and the other is language. See this next slide, you can see the picture of the brain. We have studied it. Even if you can look into the brain to see it again. Broca's area is in the frontal lobe and Wernicke's area is in the temporal lobe. See, both areas are different places, and how these work together is through the connectivity, the neuronal connectivity in between them. And if there is any problem in the neuronal connectivity or in the processing, the children go in for spelling errors, speaking errors. Okay, they won't be able to process their language properly. Any connectivity disturbance and between this Broca's and Wernicke's area. Even they should vision also should connect while reading. The vision also should get connected. Okay, so occipital lobe, then Wernicke said temporal lobe, then frontal lobe. All these have to work together for a reading to happen. So the connectivity in the brain is very important when we think of learning. Next slide. This is face and object identification network. This is very important to identify objects while learning. Okay, lateral temporal region and temporopolar region for language development also. This is very, very important. Next slide. See the face, you can see in this picture, the face recognition area is in the temporal lobe. It's written there. Okay, this area is very important for language reading, writing, and also for identification of objects. Objects, not only objects, for letters, words, etc. Okay, this is the temporal lobe area. If you have any doubt, you can ask, or you can go. You can ask in the end. Okay, we'll finish off. Then we'll go if you have any doubt. So these are the networks in the brain which we have, which we were talking about. There's one more. One more is there. Next slide, please. Executive function network. This area is needed for us to do something, to behave, to do. This area should work properly. That is mostly in the prefrontal cortex. This area. Okay, this area helps us in the execution. Whatever we have learned, whatever we understood, what information we are taking from the environment, that stimuli. I told you about the tiger, and if we have to run away, this executive function should work properly. This frontal lobe has to work properly. See, next slide. That picture of the brain, you see, frontal lobe. There is occipital frontal lobe is there. Here it has to work properly. And the parietal lobe, this lobe also should work properly for the execution of whatever we have learned, to write the exam, and to write the answer to the question, or you already know, to draw a picture and all. For us to do it, this executive function of the brain should work properly. So, next slide. What are the other factors involved in learning? There are many other factors also involved in learning. Our sense organs, like vision, hearing, touch, all this has to function properly. Memory, intelligence, attention, language, emotions, dreams, thoughts, feelings, and endocrine functions. All these have to work systematically for a learning to occur. Next slide. See the same slide only. It is it's put in a different way. See, sensory integration, organization, and interpretation should happen in all these areas, components of a learning process. That is sense organs, memory, intelligence, attention, language, and emotion, dreams, thoughts, and feelings. All these together, there should be integration, organization, and interpretation in the brain for a learning to occur. See how sophisticated, how higher function is this learning. Brain has to work properly, only then all this will happen. Next slide. See, we can look into first factor in that, sense organs. Sense organs and sensory processing. This we know, we have learned in our college while studying. So sensory processing is a complex set of actions that enable the brain to understand what is going on, both inside your own body and the world around you. So all the process, sensory process means all the sensory inputs that reaches the brain. It's a complex set of sensory inputs at a time reaching in the brain. And we have to understand what is going on inside your body and what is going on around the world for us to learn to understand. The term sensory process, next slide. The sensory organs and sensory process. The term sensory process refers to our ability to take in information through our senses. That is touch, movement, smell, taste, sight, hearing, balance, organize, and interpret that information to make a meaningful response. Next slide. These are the 5 sensory organs that helps us to understand the world around us. Next slide. So there are 7 senses which help in learning. That is tactile, somatosensory system, or sense of touch, visual system, sense of sight, auditory system, gustatory system. Next slide. Sense of taste and olfactory system, sense of smell, vestibular system, sense of balance, proprioception system, sense of body position. All these we all know, but I was going through that just for us to like understand, for that we won't forget. Okay, next slide. Next slide. That is not there. I forgot to delete it. Sense organs are the visual system. Visual processing is the process by which eyes and the brain work together to interpret light into the images and information the brain can understand. Whatever we see, the brain should understand. See, this is a very complex system. Next slide, please. This is a very complex system because we have 2 eyes and some fibers from this eye is going to this side. Some fibers from this eye is going to this side. So we have studied this. How is this a long nerve, optic nerve? How it from the eyes it reaches the visual cortex. There's a long journey, and in between they cross also. See, next slide. See how long it travels, and what there are many areas. Do you remember V1, V2, V3? No, there are many areas in this visual cortex, and all this should combine together for us to understand. Color is in one area, shape is in another area, size is in another area. So when we say capital letter and small letter, small letter is small and capital letter is big. And if the child should understand this visual area, all the visual areas V1, V2, V3, V4, all this should work together, should integrate together. If there is a problem there, the child won't be able to understand what is a big, which is small. Even numbers, 10 is big or 1 is big or 5 is big or 2 is big, whichever. So that all the child won't be able to understand if that in the visual cortex, the area is not connected properly in between them. Next slide. What is visual processing? The brain processes the visual world like symbols, picture, distances. Next slide. Detecting, next slide. Visual process. Detecting basic features like color, size, shape, motion, and texture, even movement also. We have to, visual area has to process. The texture also, on seeing we can understand if if a tomato and a potato is kept far away from us, we can just see that we know what is the texture of tomato and what's the texture of potato just by seeing it. For that to happen also, this visual area should work properly. Recognizing objects by comparing visual input to stored memories. Already we have memories, and we have to, when we see a new thing, what happens is the new information will be compared to the previous memory for us to understand. So while teaching children with a learning problem, you link and teach. Link them with already what all information already the child has. So here in Kerala, we have Arabian Sea in the west side. So when you teach a side, which is the west side, you just make the child experience the sea and tell the child where the sea is, that is the west. So the information already the child has, we have to link it, this information for the child to understand which is west. Learning disability children will have a lot of problem with directions. Okay, which is east, which is west, which is north, and which is south. So we have to link it with the information already the child has. We teach the children who have very difficulty in understanding which is right and left. The hand with which you have food, that's the right hand. That's how we link. The child will have food. All the children will have food. Okay, they have no difficulty in having food because that is their survival instinct. Okay, to have the food is their survival instinct. So we link the right with the food, that the hand with which the child is having food. Like that, we link and teach them. So interpreting the spatial relationship between objects and integrating these elements into coherent perception of the world. What is spatial relationship? One is the depth perception. Depth perception means when you are climbing down a stairs, if you can't understand the depth, actually we'll feel that we are going to fall. Okay, if you don't have depth perception properly. And when the child grows, the depth perception develops only later after 1.5 to between 1.5 to 2 years only. Until then, the child won't have the depth. After that, only the child will start climbing stairs on its own and climbing down the stairs. Once the depth perception happens. Okay, so this visual processing is a very complex process. Next slide. There are 8 categories of visual processing which helps the child to learn. Okay, first is visual discrimination. It's already 9:25. Should we stop here and continue the next week so that we can ask questions if anybody wants to learn, or if anybody did not understand? This weekend visual processing concepts we can take in next Tuesday. If it is okay with all of you. Is it okay? Too heavy it will be otherwise.
Ma'am, you can continue, I think, finish off the topic.
Topic won't finish off because the auditory
No.
processing.
Okay.
There is auditory processing also left that we won't be able to take today anyway. We can do this visual processing and auditory processing in next session. That will be the symptoms of learning disability. Okay. Today we learn what is learning and what are the process of learning. And next day we can go into, this will be the symptoms of learning disability. These processing deficits will lead to the symptoms of learning disability. Okay. This auditory processing also is there and visual processing is also there.
Okay,
Maybe
ma'am.
we can
we can continue in the next. Then.
Next, yeah. Till too heavy it will be today. Like no, when you start learning visual processing, if you go along with it, auditory processing also, it will be better for you to understand also what are the symptoms of learning disability. If you have any doubt, you can
requesting delegates, if they have any doubts, they could put it in the chat box so that ma'am could answer those questions.
If you want, you can ask now. Somebody is telling next time, few questions to next time. If you want, you can ask now itself, or you can go to the next session and next Tuesday we can. Next Tuesday it will be at 8 p.m. Okay, today I had a function, that's why I requested to make it to 8:30. Next Wednesday, next Tuesday it will be 8 p.m. only.
Hi, ma'am. This is Dr. Munawar Sheikh from Bangalore. I had few questions though with regard to some cases. So maybe we could do it next time since we are already late today. So once you complete the whole thing, then maybe I will have some more questions for you.
Yeah.
Thank you so much. It was a very exhaustive one. Yeah.
Maybe your questions will be answered in the next session, maybe. So
absolutely, no issues at all.
Yeah.
But very nice presentation. I was very impressed with this. So yeah, I'll see you tomorrow next time. Whenever we have this, I have a few queries. I'll ask you. Okay. Right.
Okay.
Thank you so much. Bye-bye. Yeah.
Bye.
Any questions, delegates?
If there are no questions, I'll be happy because I understand that everybody understood everything so well. So I'll be happy. Thank you for listening to me and pranams to you all, because I could say all properly because you all listen well, very well. Thank you. Thank you, HNA Women's Wing.
Thank you, ma'am, for that enlightening session. Ma'am, I would like to request Dr. Shilpi Rastogi, ma'am, Professor, Department of Anatomy at Yenapoya Homeopathic Medical College, to extend the vote of thanks for today's session. Dr. Shilpi. Dr. Shilpi, kindly unmute yourself.
Thank you, Dr. Triveni. On behalf of IHMA, Indian Homeopathic Medical Association, a very good evening to one and all present here. On behalf of IHMA National Women's Wing, I extend my heartfelt gratitude to our esteemed speaker, Dr. Anupa Rani CR, and to her humble and modest nature, as we all saw just now, that she's folding her hand in front of all of us, and so modest it is. And extend my heartfelt thankful for your enlightening and insightful session. And we wish to learn from you in the next session as well on learning disability. Your talk has truly helped us to understand and appreciate that how you have learned in these many years, that how learning disability develops, because the experience is being visualized very clearly. So a special thanks to ma'am for joining with us and sharing her expertise in this field. I wish to thank our chairperson, Dr. Heluvine Coelho, and our convener, Dr. Jagati, for their constant support and guidance in organizing such meaningful events and bringing all of us together at one platform for learning further. And lastly, my sincere thanks to all the participants that in spite of working day, in spite of evening, they could join in such a huge number and learned from the seniors. And thank you for the people who are asking questions, for showing patience, for let ma'am complete her next session and then she can answer all the questions. So we look forward, all of you, for your presence for the next session. Thank you one and all, and thank you ma'am once again. Over to Dr. Triveni.
Thank you, Dr. Shilpi. Ma'am, our next session would be on 14th October 2025, wherein ma'am should finish the remaining part of today's session and hopefully some insights on the pathology of learning disorders and its implication. Hope to see you all for the next session for enhancing our knowledge on this topic. Till then, take care and have a good night. Thank you.